I'm Dr. Tobin Eicher. I'm a family medicine doctor, and I practice at Adams Memorial Hospital in the Decatur office. Why do I like being a doctor? I like being a doctor because I get to help people in my community. I get to talk with people all day. I'm a very social person. I enjoy chatting with everyone of all walks of life. I get to talk with 3-year-olds and I get to talk with 93-year-olds. It's very rewarding to see patients, whether it's just an annual checkup and I get to keep them in their proper health, or whether they're at a very low point in their life or they're needing help and I'm able to reach out with that help. I chose Adams Memorial Hospital because I grew up in this community. I know that they've made an effort to remain independent in the community, which means rather than having a CEO miles and miles away or even states away making decisions, we've got someone local here that hears what the community needs and we're able to talk with them, make changes. Adams just has a reputation of being supportive of their staff and giving the doctors what they need to treat the community the best they can. However, practicing in a rural community like this, I'm allowed to do the broad spectrum of things that I was trained on. I can treat heart conditions, lung conditions, all those things. And then we reach out to the specialist when we need additional support or further testing, but we're allowed to do really everything that we were trained on. When I compare Adams to larger hospitals, what's unique here is that pretty much every provider knows every other provider. When I send someone to the emergency department, I know exactly which doctor I'm sending them to. And then when I pass that doctor walking to my car on the way back, or I eat lunch with them, I know exactly the person who's taking care of my patients, and they know who they're sending their patients back to for follow-up. In a small community like this, there's just a lot of networking and a lot of communication that keeps patients from getting lost or falling through the cracks. When you're a family and you're considering where to get your medical care, it's important to consider more than just medicine, but the social factors too. When you come to Adams, you likely are being treated by a doctor that lives in the community, maybe that grew up in the community like myself. In bigger cities, you never know if they're flying in from Chicago, if they're working from the outskirts, or just what part of the larger community they're a part of. But at Adams, you can pretty confidently say that they're within the community helping out, whether that's when they're on the job Monday through Friday or when they're volunteering on the weekends or evenings. That doctor is a part of the community.